For the very latest in the fight against COVID, we know things are always changing. Joining us now is Dr. Anne Liu with Stanford Health Care. Thanks for being with us today. Let's get right into the latest because COVID cases are continuing to rise across the Bay Area, yet we're not seeing mask mandates coming back into place. Do you think that's an all right idea?
That's tough. So, I think it is so much harder now to bring back mask mandates because there is so much pandemic fatigue. I think people are really across the board feeling like, they're pretty done with this whole situation. And I can understand that. Mask mandates might would potentially have a smaller impact on reducing hospitalizations now than they did before, with high vaccination rates and high rates of prior infection and better availability of high filtration masks, more preventive therapies for people who are immunocompromised and more treatments for high risk individuals. Masks and distancing are not the only tools that we have anymore, fortunately. So this is not to say that masks are unnecessary, but that our reliance on masks to reduce COVID deaths when we can't distance is no longer so absolute. That said, we are also just starting to understand the impact of prior COVID infections on long-term health consequences, including in people who have had mild infections. So, while vaccines protect well against severe disease in most people, Omicron variants have reduced vaccine effectiveness against infection, reinfection, and transmission. So as well, in addition, unvaccinated kids under the age of 5, immunocompromised people of any age, and folks at high risk of complication really remain at the community's mercy. People who are essential workers, people who can't afford high filtration masks, people who care for high risk individuals could potentially benefit more from masking rather than less masking. And even without mandates, though, I hope that people, when they're indoors with others, that they think of voluntary masking as sort of an act of courtesy for others, and that we are empowered to make that choice and to choose to mask to protect people around us.
I think this answer depends on the variant, but let me just throw it out there to you. What is the latest on how long you'd have to be in close contact with somebody in order for the virus to spread?
I think that I haven't seen much that is updated on whether it can happen in a shorter period of time than before, but it does seem that at least anecdotally, that people don't have to be in close contact with others for all that long indoors for transmission to occur. Now, outdoors is still very different, so you can still be near somebody outdoors for a period of time and the risk of transmission is low. But indoors, especially because there can be airborne particles that are hanging in the air for a period of time after somebody has left that environment, or that accumulate as somebody who's infected is sitting in that room, can happen quite easily.
Yeah, so that kind of throws out the rules as far as actually being in close contact with somebody if it can exist long after they leave. I also want to ask about the immunity factor. You had referred to this when it comes to prior infections. What is the latest on, say somebody got COVID during that last big surge, late December, January here in the Bay Area. They got Omicron. Do they have any immunity at this point?
So they would have immunity against the variant that they had the infection with. So that's the tricky part. Since we keep seeing new variants, and now we are on to additional Omicron-derived variants, we're seeing that people who had Omicron are still able to get infected potentially with some of the new Omicron variants. And there's data from South Africa that suggests that that prior infection with Omicron is not as protective as we would want it to be against some of the newer BA.4 and 5 variants.
Why are there so many variants of Omicron?
Well, when virus replicates a lot, it has a lot of chances to create mutations. And the more mutations that are occurring, as there's so much replication going on everywhere around the world, the more chances there are for a cluster of mutations to occur that has some sort of transmission advantage. Either it's more transmissible, or it can transmit in people who previously have been infected with prior variants. So the concern is that the more widely it spreads, the more we will see new variants. In addition, when people whose immune systems are weaker, or people who are immunocompromised get infected, there's the possibility of, even with treatments, of that virus hanging around for much, much longer than in somebody with a normal immune system. So we've seen people who have compromised immune systems have replicating virus for months, not just the days to a couple of weeks that you see in somebody with a normal immune system. And so the longer it hangs around in somebody who has a compromised immune system, the more it has chances to also accumulate mutations. So, I think that for public health reasons, we should try to limit spread if we can, to limit the number of chances the virus has to make mutations, and then also protect those who are at higher risk, those who are immune compromised, from getting infected in the first place.
Now, speaking of people who are at higher risk right now, there's a second booster available to them, older people who are immunocompromised. When do you think there might be a second booster available for everybody?
Oh, great question. So first thing to know is that the first booster is quite important in boosting protection against the Omicron variant. So, if you're 12 years old or older and up, and have gotten the first 2 shots of an mRNA vaccine or 1 shot of a J&J vaccine, go ahead and schedule that first booster dose. As for the second booster, it's unknown currently whether folks under the age of 50 would benefit much from a second booster at this moment in time with the variants that we have right now. Currently, the data on mRNA vaccinations shows that the second booster for folks 50 and over produced an increase in protection against infection with the original Omicron that lasts for a couple months. And from a second study, it seems to reduce a risk of severe disease and death in that age group. But younger people in a study of healthcare workers didn't really experience a significant increase in protection against infection with a second booster. The protection against severe disease and hospitalization is still really excellent, even with the waning antibodies seen after the first booster. And so antibodies are not the whole story. So whether or not another booster will be beneficial for people who are 50 and over will depend probably on the next variants that we see.
Okay, well, we will keep an eye on it, and we really appreciate your perspective. Dr. Anne Liu with Stanford Health Care, thanks for joining us on CBS News Bay Area.
My pleasure.